your physiology. This topic can be asked in your psychiatry. The question will definitely come from this topic. It doesn't matter which subject they are following. Okay. So, what are the probable questions either in pre-PG exams or either in your FMG exams which are going to held in this August last week? Sleep. They are going to basically ask these questions: stages of sleep, waves of sleep, EEG finding, abnormality of sleep, treatment, about insomnia, about the HLA, and about the different kind of waves. So our topic of discussion is around these things only, because in sleeps lots of deviation is there, but that is not important for your exam point of view. For exam point of view, this is the important. So sleep is basically categorized in two parts. First is non-REM sleep, and the second one is REM sleep. So the first questions will come from only these parties. Which one is contribution is more in this? This is around 60 to 70% of this sleep. This is around 60 to 70, and this is around 20 to 30%. So maximum contribution is non-REM sleep. Out of this, non-REM sleep is divided into stages. Okay, stage 1, stage 2, stage 3, and stage 4. The question will come from this area is which stage is maximum, and this is the maximum, and this contribute about 40 to 50%. Non-REM stage 2 contributes maximum, that is 40 to 50%. Stage 1 contribute about 5 to 10%. Stage 3 contributes about this one around 50 to 20%. So the questions will ask from this area is this. Now the other questions will related to the name. What are the different name for the non-REM sleep, and what are the different REM for the REM sleep? So what are the different name for non-REM sleep, and what are the different name for REM sleep? First, I am going to tell about the name of the REM sleep. Non-REM sleep. This is also called as sleep. This is also called as sleep. This is also called as slow wave sleep. This is also called as slow wave. This is also called as quiet sleep. Can you guess the other name? Yes, this is also called orthodox sleep. Orthodox sleep. And the last one is synchronized sleep. Synchronized sleep. So these are the name for the non-REM sleep. These are the alternate name used for the non-REM sleep. If you remember this, you can easily guess what will be the name for the REM sleep. This is S sleep. This is D sleep. This is slow wave. This is active sleep. Active sleep. This is orthodox sleep. This is paradox sleep. paradox sleep. This is synchronized sleep, so this will be desynchronized sleep. Desynchronized sleep. So you can easily differentiate between these two. Here you will get A wave. A wave. Now the next questions will be from what you will get in non-REM sleep, what you will get in REM sleep in EEG finding. EEG finding. EEG finding. Different kind of wave you will get in EEG in case of non-REM, because this is divided into different kind of stage 1, stage 2, stage 3 and stage 4, and you will get definitely these questions from EEG finding. 1, you will get theta wave. You will get theta wave. In stage 2 you will get K complex. K complex. Stage 3 and 4 you will get delta wave. Basically in stage 3 delta wave is going to appear and this will continue in stage 4. How will you going to remember in exam? That is tough. How will you going to write? Theta, theta. That is T. T. You are written like this. That is stage 1. Delta. This comes at alphabet number 4. So you can easily remember this one. Complex is only for when two things will combine together. That is in stage 2 you will get K complex. So it will be easy to remember. How? What you will get in case of REM sleep? You will get low voltage activity, low voltage fast activity wave, and this get a special name that is called as sawtooth wave. This will get a special sawtooth wave. So you will get a question sawtooth wave you will get in case of REM sleep. So this will be the question scenario. How will you going to remember? This will going to remember by writing the name only, and if you find this name automatically this will get in opposite, that is in case of REM sleep. What I am going to deliver here is only how to recall in exam and how you are going to mark this correctly in exams. I am not going to give any concept in this because time is very less and you are going to write paper in August last week. Now this will be your EEG finding. It is EEG finding. What will be EMG finding? Electromyogram finding. This will be related to the muscles. What you will get in case of non-REM and what you will get in case of REM. Here you will get partial relaxation. Partial relaxation. In case of REM sleep, you will get atonia. Very important. Atonia is the feature of REM sleep. Atonia is the feature of REM sleep. Don't get confused. Now the most vital part and most important part of this REM and non-REM sleep is what are the abnormality of REM sleep and what are the abnormality of the non-REM sleep. The list is huge and it's very difficult to you to remember each list. So I am trying to cover this list by the mnemonic, and that mnemonic lies in the name itself. That is REM. What is written like that? That is written like this one. What are the abnormality of the REM sleep? You just read it, not REM, read it name. Just replace R with N. You will get the answer easily. N is for narcolepsy. Narcolepsy you will get in REM sleep. E is for erection. This is penile erections. And M is for mare. And what mare? This is nightmare. Okay. Apart from these three, what abnormality written in any place all comes under non-REM. As simple as it. But you have to know a little bit more about the narcolepsy, erections and nightmare. What you must know in case of erection. Erection is a physiological things. First. That means by seeing this, you can easily distinguish between psychological and physiological cause of impotence. Psychological and physiological cause of impotence. If it is normal, then what will be the number? How many times the action can called as normal? Yes, this will be 100 minutes per day. 100 minutes per day, that is normal. Okay, so you can easily differentiate between these. What about the narcolepsy? I will discuss narcolepsy in detail. First, let's list out all the non-REM abnormality. Non-REM abnormality. I can understand you can easily write down all the name abnormality for the non-REM. Only apart from these three, narcolepsy, erection and nightmare are for the REM. Okay, so let's first enuresis. Bedwetting, enuresis. This is in non-REM. Can you guess male or female? Which is more prone to enuresis? Male more common enuresis at the age of 4 to 8 years. Okay, enuresis. Bruxism. What is bruxism? It is basically teeth grinding during the sleep. This occur in case of non-REM sleep. Third, somnambulism. What is this? Yes, this is nothing but this is sleepwalking. Person is walk during the sleep. You can easily correlate with one movie. That song is okay. What will be the other feature? That is terror. Night terror. Nightmare is the feature of narcolepsy. Features of REM sleep. Sorry, feature of REM. But night terror, other name, Pavus nocturnus. Pavus nocturnus is the feature of non-REM. So you can easily remember, apart from 3, what comes in your mind, that comes under this. What are the treatment of night terror? This is feature of sleep, and they are going to disturb in the sleep. So what you are going to do, just let them sleep by giving diazepam. So diazepam treatment is by diazepam. Sleepwalking, somnambulism, where you will get, in a stage 3 and 4 of non-rem. Stage 3 and 4 of non-rem. Okay, so this will be the feature of rem and non-rem. If you know the feature of rem and non-rem, what you are getting, atonia, active sleep, everything is in rem sleep. That means if they ask about what will be the temperature of the brain, the temperature of the brain, automatically you will get brain temperature high in case of non. If they ask about the cerebral metabolism, then cerebral metabolism, it will be high in case of rem. So this will be the basic difference between rem and rem. What you will get another feature in case of rem, that is most important one feature I forgot to mention about, where you will get EEG. Where is EEG? Here you will get pontogeniculo occipital spike. You will get in rem. Pontogeniculo occipital spike you will get in, where you will get in REM sleep. In exam you will get questions where these wave get origin, alpha wave, beta wave and theta wave. From where they will get beta, all of you know beta is from frontal lobe. This is the frontal lobe, and this is parieto-occipital. That is parieto-occipital. What you get? Alpha wave, and theta wave is from hippocampus. Theta is from hippocampus. So try to remember these first. Beta is frontal lobe, then automatically parieto-occipital is alpha, and lastly the theta is from hippocampus. So you can easily do the correct in exam. What a simple difference between alpha wave and alpha block. A student easily get confused. Alpha wave produce when eye is closed and mind is wandering. You will get the alpha. When it is replaced by fast irregular wave, then alpha wave going to disappear and it will be replaced by the other wave. That is called alpha block. What are the frequency? 8 to 12 hertz. This is the frequency of the alpha wave. Okay, now the important part what I have left is narcolepsy. in exam there is chances you will get definitely question from these topics, either in pharmacology, either in physiology, or either in psychiatry. Narcolepsy, that is much important. What is this? This is basically hypersomnia. Hypersomnia at daytime. So you can tell it like this is basically a sleep attack during the daytime. Sleep attack during the daytime. What are the characteristics in case of narcolepsy? You will get cataplexy. Cataplexy. You will get hypnagogic hallucination, and you will get sleep attack. If you get these three findings, that means you are dealing with narcolepsy. What you will get in narcolepsy? Basically in narcolepsy you will get decreased REM latency. Decreased REM latency. Why this narcolepsy occur? What are the pathophysiology behind this? What are the pathological abnormality behind this? What are the changes because of this narcolepsy occurs? And this is because of malfunctioning of hypothalamus. Don't get confused in exam. What I am writing is here hypothalamus. Earlier what I have discussed, theta baby is hippocampus. Don't get confused with H and H. This here I am talking about hypothalamus. Here I am concerned with your sleep wake cycle. I am concerned with hypothalamus. Okay, so this is physiology behind this. If in exam, if they ask narcolepsy is related to which LA, this is related to HLA-DR2. HLA-DR2 associated with narcolepsy. So this you will get in exam. What are the FDA approved drug for the treatment of the narcolepsy? You know the name of the drug, and the name of drug is modafinil. If you know the name of modafinil, this is FDA approved, then definitely you will get a question, what are the other conditions where modafinil is approved by FDA for the treatment? And if you go with the name, you will get modafinil. Oh, this is obstructive sleep apnea syndrome. Obstructive sleep apnea syndrome. This is N. This is narcolepsy. And this is L. L means lethargy. This is important. Lethargy, treatment of lethargy. Where you will find the lethargy? In case of depression. Lethargy in case of depression, where FDA has approved for the drug modafinil. And this is shift worker. S is for shift worker. So modafinil FDA approved in case of obstructive sleep apnea syndrome. By the name you can remember. N for narcolepsy. L is for lethargy in case of depression patient, and S is for shift worker, where you get FDA approved modafinil for the treatment. one another questions you will encounter in exam is restless leg syndrome. Which vitamin is associated with restless leg syndrome? And this you will get is vitamin B12 deficiency. Okay, this is what are the other name? Other name is Ick-Boom syndrome. Ick-Boom syndrome. Other name is Ick-Boom syndrome. And what are the treatment, or you can say drug of choice? And drug of choice is dopamine agonist. Can you name the name of the dopamine agonist? That is propinerol. Propinerol. This is drug of choice in case of restless leg syndrome. So you will encounter different questions in exam. Out of this you have to memorize what are the important and what is not important for the exams. Otherwise you will miss the important questions during the exams. So what will be your approach to cover up this topic and encounter this topic during the exam? First, focus on the REM sleep. What are the abnormality of the REM sleep? What are the other name for the REM sleep? And start with the REM sleep. Automatically the opposite will be the non-REM sleep. Okay, the important things. If any abnormality, if suddenly they will ask initial 1/3 of the phase, any abnormality of non-REM sleep occur, and the later half of the REM, the abnormality of the REM sleep occur. So if we ask particularly about if cycle is this much non-REM and cycle is this for the REM, if they ask by giving the name initial 1/3, you will get the abnormality of non-REM, and in later half, this will be the later half, you will get the abnormality second half of sleep. You can say second half of sleep you will get the abnormality of REM sleep. So this will come as a question in your exam, and then you have to mark out what is important and what is not important. So some guideline has given what to do and what to not do in you can say this. What we are reading is sleep. So one important, you can say, concept that is called as universal sleep hygiene. Universal sleep hygiene given for the sleep. What are the universal sleep hygiene? In this theory, some concept has been given what to do and what not to do and don't do during the sleep or going to sleep, and for your bedroom, what to do, what to not do. This is basically the universal sleep hygiene. They have given what to do means they have given you have a regular sleep wake schedule. First thing they have talked about the schedule. You have the regular wake schedule. You have to do regular exercise. You have to do regular exercise. Mind it, what written in the exam, you have to do regular exercise. It does not mean that you are going to do exercise just before the sleep. This is not encouraged. Second thing, your bedroom should be free from noise, free against basically excessive noise. I am talking about the basically excessive noise. They are free from the excessive noise, excessive light. That is not encouraged. That is not encouraged, excessive light. When what to do when you feel sleepy, then only go to the sleep. This comes under do. And the last, use bed for the sleep. For the sleep, use bed for the sleep only. It's not like that you are eating food, you are reading on the bed, eating on the bed, playing on the bed. Bed is used for only for the sleep. And this is for the do part. And eating a light snack before retiring if hungry. If you feel like you are hungry, then take a light food. Okay, what comes under don't do? Don't do. Comes under that? First thing, avoid strenuous exercise before going to bed. First, avoid exercise before going to bed. First. Second thing, abstinence from alcohol, tobacco, alcohol, tobacco, abstinence from alcohol. Minded, don't take, don't take tea, or don't do read, matlab don't use books, you can say books, or talk on phone or watch television during the sleep. When you are going to sleep, don't do like that, take it, read book, watch television. This will not going to encourage in universal sleep hygiene. If you are chronic pill user, don't practice this. That means you are going to daily use pill for going to the sleep. And bed should not be the emotional or sexual battlefield. Okay, this should not be used. Okay, that means bed must not become an emotional or sexual battlefield on which couple work. Okay, so purpose is to, this is universal sleep hygiene is to what? The purpose of universal sleep hygiene is to promote healthy sleep. The problems comes when you are not taking the healthy sleep, then the complaint of insomnia occur, or parasomnia, hypersomnia occur. This type of complaint is done, complaint by anyone. So this is basically about the sleep part. If I think I have not left anything here, so I have covered each and every part, and hoping you will not get a single question beyond this. If you get in exam a question on the graph and something like that, then probably that graph will be of K complex, that is stage 2, or they will give you of the beta, the fast active, fast frequency fast activity wave. So if they will give you the image based question, they will give you that, and otherwise they are bound to give these things. So this is all about the sleep, and hope this information is sufficient to encounter your pre-PG exams and FMG exams. And this is all about this part. Okay, and I will guarantee you that DNA is going to encounter your each important topics, what they are important for your this exams. FMG August last week's exam, that will cover each and every aspect. Thank you so much.